Welcome back, friends, to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is a real treat, Dr. Mark Raphael. Thank you so much for being here. How are you, doctor?
Good morning. I'm well, Colette. Thank you for having me.
Of course. We're delighted you're here. Doctor, it is Colorectal Cancer Awareness Month. You know that. And to start it off today, tell us a little bit about this disease, doctor.
According to the American Cancer Society, colorectal cancer is the third most common cause of cancer in men and women in the U.S. It's a lifetime risk of about 1 in 25. Based on 2022 estimates, there can be up to 150,000 new cases projected for this upcoming year. And despite that, these numbers have improved greatly since the mid-1980s due to preventative screening modalities.
Oh, that's great to hear. So, and many say, doctor, that this disease can be prevented, like you just said. How so?
Well, preventive care medicine is important to detect disease before it becomes more problematic down the road, avoiding potential cancers, and we take steps to detect and remove abnormal tissue. The gold standard for colon cancer screening is a procedure called a colonoscopy, in which your doctor can directly visualize the abnormal tissue called polyps in the colon. Colon polyps can be safely removed so that they do not turn into cancer into the future, ultimately decreasing your risk for colon cancer by up to 90%.
Okay, so doctor, we know, like you're saying, that screening is recommended, so important. Can you go over there are several types of screenings and at what age it's recommended to get these screenings for colorectal cancer?
Sure, thank you for asking. So colonoscopy is an ideal tool that allows the diagnostic and therapeutic interventions to be delivered at the same time. In other words, we can visualize the abnormal tissue, those colon polyps, remove them in their entirety so that you're clear for years to follow. One of the most important updates in 2021 is that 45 is the new 50, meaning that your first screening colonoscopy should be at age 45 now and not 50 like before. And that goes along for average risk individuals also. Generally speaking, those without a family history of colon cancer or other inherited syndromes in the family. If you do have a family history of colon cancer or carry other risk factors that you discussed with your doctor, you should plan to be screened maybe sooner, usually at age 40. Alternative methods do include stool testing for DNA mutations. There's an FDA-approved stool test called Cologuard. It should be noted that an abnormal stool study will still require a colonoscopy for identification and removal of that abnormal tissue. And one of the other less utilized modalities is a CT colonography, which is a picture of your colon. It requires the same type of follow-up as the stool DNA test, if abnormal.
Okay, so those are all very, very important. Doctor, there are some unusual signs and symptoms that people should really watch out for that could indicate a problem. Tell us about those and what people should do if they suspect something is wrong.
Yes, so colorectal cancer may not cause symptoms right away, but if it does, it can cause a change in bowel habits, diarrhea, constipation, a change in the caliber of your stool, such as narrowing. Blood in the stool is a big one. Abdominal pain, unintentional weight loss, and changes in some of your laboratory blood work that your doctor can review for you. This list isn't meant to be exhaustive, but if there are any of these problems, it's important to see your doctor right away, especially your primary care doctor, and we can find out, look into these things more closely if needed. Yeah,
and you know, doctor, so many people are nervous to talk about this cancer, talk about this topic, cancer, colorectal cancer, what have you, but why is it so important to have this conversation?
That's a great question. I'm happy you bring it up. I think the fear of the unknown makes people nervous, and screening for colorectal cancer is important because patients are taking a proactive role in their health to prevent a potentially larger problem down the road. And colonoscopy is a safe and effective method to prevent a common and possibly fatal disease. And I know at Covenant Digestive Care Center in our endoscopy department, we follow strict quality metrics, evidence-based guidelines to ensure you feel comfortable the day of your procedure and are followed correctly in the future.
Well, doctor, we know that you're totally knowledgeable about this topic, but you also are very passionate. What motivates you to care for your patients and to do what you do?
Thank you. I think people are very smart and they're intuitive, and they've implemented the information and things we've talked about today, for instance, to make important decisions about their health, and I'm grateful to be on that journey with them.
Well, doctor, we were so delighted to have you here because you brought this topic to us in an easy to understand manner. So thank you so much for being here. We appreciate you calling in. Thank you.
Thank you for having me.
Of course. If you'd like any more additional information on today's topic, just head on over to the Hot Links page at WNEM.com.